Today I'm going to discuss about the non-steroid anti-inflammatory drugs. So basically, the what are the non-steroid anti-inflammatory? Before going into the classification of the non-steroid anti-inflammatory drug, first we will discuss about the production of the prostaglandin and leukotrienes. So basically, this arachidonic acid, which is basically the precursor of the prostaglandin and leukotrienes. So this arachidonic acid is basically the component of the cell membrane phospholipid. So phospholipase E2 act on these phospholipid and free this arachidonic acid from the cell membrane. Then here is the arachidonic acid undergoes two pathway, whether depends upon the location uh, and presence of these two enzymes, cyclooxygenase and lipoxygenase. Cyclooxygenase are two isoforms, one COX-1 and COX-2. So COX-2 is basically present on most tissues, while COX-2 present as site of inflammation. So normally COX-1 enzyme is expressed, it is present in stomach and platelet cells. Second, this is present in mainly kidney and brain. So there are two types of the COX-2 isoforms, COX-1 and COX-2. Basically, this is the same structure but work as a different function. So that's why there's two isoforms present uh, in the human body. So what happen if cyclooxygenate work on the arachidonic acid? This arachidonic acid is converted into endoperoxidase, and this endoperoxidase converted into the prostaglandin and thromboxane. So prostaglandin and different type of thromboxane has a different function. The prostaglandin function is maintain PDA, patent ducted arteriosus, dilate renal arterioles, dilate renal arterioles, it's dilate renal arterioles, renal arterioles, contraction of uterus, growth of gastric mucosa. So growth of gastric mucosa to protect it from the corrosive effect of the HCl. So thromboxane A2 are basically the platelet aggregators. They lead to the platelet aggregation and lead to the formation of thrombus. So there are the two types of the NSAIDs. One reversibly inhibit this COX, and second irreversibly. There is only one drug that irreversibly inhibit this COX, and this is aspirin. So aspirin is a unique mechanism of action. It irreversibly inhibit the cyclooxygenase COX-1 and COX-2 enzyme, while other NSAIDs inhibit COX-1 or COX-2. reversibly. On further classify, we can further classify the NSAID into two types: non-selective and selective. So non-selective mean it works or it inhibits both COX-1 and COX-2, while selective it inhibit only COX-2. So now I'm going to discuss about the classification of NSAIDs. So NSAID are two types: selective and non-selective. So basically, selective NSAIDs are inhibit only the COX-2 enzyme, while the non-selective inhibit both COX-1 and COX-2. So the example of the selective COX-2 inhibitor are Celecops. So these drugs are GI protective, GI protective, and they increase the risk of the thrombus formation. As we already know that COX-1 mainly present on the stomach and platelet and most tissue. So we, in case of the selective NSAID, we inhibit only the COX-2. So the COX-1 is not inhibited. So the this thromboxane formation is increased, and this lead to the platelet aggregation, and this lead ultimately to the thrombus formation. So the COX-2 inhibitor are contraindicated in myocardial infarction. Next, so non-selective NSAIDs are aspirin. Aspirin is a unique NSAID because it inhibits the COX-1 and COX-2 irreversibly, while other NSAID inhibit the COX-1 and COX-2 reversibly. So this is a unique property of the aspirin, while these are the other name of the NSAID: diclofenac, ibuprofen, endomethacin. Endomethacin used to close patent ducted arteriosus (PDA). So it's imported stuff and high yield stuff. And ketorolac is available in parenteral form. So these are the basically the overview of the classification of the NSAIDs.
So all the NSAIDs of antipyretic effect, analgesic, and anti-inflammatory effects. So NSAID can be used as fever relieving drugs to relieve pain and anti-inflammatory effect. So now the aspirin is a unique NSAID. It is the only NSAID that irreversibly inhibit both COX-1 and COX-2. So it is a non-selective, irreversible inhibitor of the COX-1 and COX-2 enzyme. So when it inhibits the both COX-1 and COX-2, it leads to the decreased synthesis of thromboxane and prostaglandin. So when it decreases the thromboxane production, it will lead to the decreased platelet aggregation. So platelet aggregation which ultimately lead to the blood thinning. So that's why aspirin used in MI and stroke patient as a blood thinner. Now, because it inhibits the platelet aggregation, So it lead to the increased bleeding time because bleeding time dependent on the platelet aggregation and it has no effect on the prothrombin time and partial thromboblastin time. So because the partial thrombin time and PTT depends on the coagulation factor. So aspirin has a multiple uses. Uh, it on low doses, it decreases the platelet aggregation, and intermediate doses, it acts as an antipyretic and analgesic drug, while on the higher doses, it acts as an anti-inflammatory drug. So side effects of the NSAIDs are, so it lead to the gastric ulceration, lead to the acute kidney injury, interstitial nephritis. So, in case of the acute kidney injury and interstitial nephritis, it is because of due to a decreased prostaglandin. Prostaglandin cause increased blood flow to the kidney because prostaglandin dilate afferent arterioles of the nephron. If you decrease the prostaglandin, which is a protective effect on the kidney, so you are decreasing this prostaglandin synthesis and the protective effect of the prostaglandin on kidney is decreased. So the gastric ulceration is also due to the decreased prostaglandin because prostaglandin is the increased gastric mucosa, so which lead to the mucosa and protect from the gastric from the corrosive effect of the HCl. Now the GI bleeding is basically due to the decreased thromboxane production. Now the super high yield side effect of the aspirin is a Rye syndrome. So Rye syndrome is basically the aspirin induced, it is a heparin induced hepatic incap in the children who suffer from the viral infection. So aspirin is a contraindicated in the children who suffered from the viral infection. So the toxic doses of the aspirin causes respiratory alkalosis early, but transition to the mixed metabolic acidosis and respiratory alkalosis later. Though aspirin has a no antidote, so the overdose of the aspirin is treated by the sodium bicarbonate and the gastric lavage. Now is the we are going toward the Celecox, which is the selective COX-2 inhibitor. So it is a selective COX-2 inhibitor. So it spares the COX-1 enzyme, which helps them maintain gastric mucosa. So the selective COX-2 inhibitor are the GI protective. So it has no corrosive effect of the GI lining. It spares the platelet function because it has no effect on the COX-1. So it has no effect on the COX-2, so it lead to the increased thromboxane formation, which lead to the thrombus formation. So it leads to the increased risk of thrombosis. So it is a contraindicated in MI. So it's also lead to the sulfa allergy. So adverse effect, it's used in a rheumatoid arthritis and osteoarthritis.
Acetaminophen is a not NSAID because it's lack anti-inflammatory effect. But acetaminophen inhibits cyclooxygenase, mostly in CNS COX-3. So one thing it's inhibit COX-3. So it's inactivated peripherally. So acetaminophen, the super important use of acetamin, always use acetaminophen in the children who suffer from the viral infection to avoid the Rye syndrome. So what is the Rye syndrome? Rye syndrome is basically the hepatic incap which is induced by the aspirin in the children who suffer from the viral infection. So the overdoses of the acetaminophen produce hepatic necrosis and this hepatic necrosis deplete the glutathiones. So antidote of the acetaminophen is an acetylcysteine which regenerate these glutathione, which is depleted by the overdoses of the acetaminophen.